Establish a strong support system within the family to protect children from drug addiction. Drug abuse or substance abuse refers to the use of certain chemicals to create pleasurable effects on the brain. Raising a child in the present-day society can be quite challenging, but as a parent, you hold the key to guiding your teenager in the right direction. One of the most pressing concerns for parents is how to shield their children from falling into the trap of drug abuse. According to medical professionals, the adolescent brain is especially susceptible to being altered by substances that hijack the brain's reward system. It is not uncommon for some youngsters to experiment with alcohol or drugs at a very early age, which can have detrimental effects on their development. Parents who themselves engage in substance use face significant obstacles in providing proper care for their children and may struggle to prioritize their child's well-being. A lack of open communication and awareness within the family unit can further exacerbate the risk of a child turning to drugs as a means of coping or seeking pleasure. Parents must establish a strong foundation of trust and communication with their teenagers, fostering an environment where the child feels comfortable discussing their concerns and seeking guidance when faced with peer pressure or difficult situations. By being actively involved in your teen's life and providing them with the necessary support and guidance, you can help steer them away from the dangers of substance abuse. Red flags. Signs that may indicate drug use include a sudden decline in academic performance, uncharacteristic mood swings, and irritability. These changes in behavior can be red flags that something is amiss and may warrant further investigation. Additionally, struggling with depression and difficulty altering mood, as well as peer pressure and the need to fit in, can contribute to a teenager turning to drugs as a coping mechanism. A sudden change in friends can also be indicative of potential drug use. Other possible red flags of drug use include substance-using parents, unusual eating habits, sleeping pattern disorders, and changes in physical appearance or hygiene. These signs, when observed in conjunction with other behaviors, can paint a clearer picture of a teenager's potential involvement with drugs. Frequent requests for money, coordination issues, or declining school performance may also be warning signs that should not be ignored. Moreover, stealing money or valuables, irresponsible behavior, poor judgment, and a general lack of interest in previously enjoyed activities can all point to drug use. Furthermore, breaking rules, withdrawing from family gatherings, the presence of medicine containers despite no illness, and drug paraphernalia in a teen's room are all concerning signs that should prompt parents or guardians to have a conversation with their teenager. Frequenting high-risk environments or locations associated with drug use can also be a cause for concern. Caregivers need to be vigilant and observant of these potential red flags to address any issues promptly and provide the necessary support and intervention for their teenager. If children are lonely or dealing with stress, they are more likely to use substances to distract from these feelings. Adolescents are often more inclined to experiment with substances when they are in a social environment. This could be due to peer pressure, curiosity, or simply wanting to fit in with their friends. The social setting can create an atmosphere where trying substances seems more acceptable or even encouraged, leading teens to take that first step towards experimentation. It is important to be aware that teenagers may also turn to substances as a form of rebellion against family rules or as a way to challenge authority. This behavior can stem from a desire for independence or a need to assert their own identity. Also, there is a risk that teens may seek out substances online, believing they can enhance their performance in sports or aid in weight loss. Parents and guardians must monitor their teens' online activities and educate them about the potential dangers of ordering substances from the internet. Potential negative consequences of drug abuse include: drug abuse can lead to a wide range of physical health problems, such as liver damage, heart disease, respiratory issues, and a weakened immune system. Substance abuse can also result in malnutrition, weight loss or gain, and an increased risk of infectious diseases. Long-term drug abuse can have lasting effects on the body, impacting overall health and well-being. Mental health disorders are another potential negative consequence of drug abuse. Substance abuse can exacerbate existing mental health conditions or trigger the development of new disorders such as depression, anxiety, psychosis, and personality disorders. Drug abuse can also lead to mood swings, paranoia, hallucinations, and impaired judgment, affecting an individual's ability to function in daily life. Impaired cognitive function is a common consequence of drug abuse, particularly with long-term or heavy use. Drugs can interfere with brain chemistry, leading to memory problems, difficulty concentrating, impaired decision-making, and reduced problem-solving skills. Cognitive impairment can impact a person's ability to learn, work, and maintain relationships, ultimately affecting their quality of life. It is important to recognize the potential negative consequences of drug abuse and seek help if needed to address these issues. When an individual is struggling with substance abuse, it can strain their relationships with family members, friends, and romantic partners. This can result in feelings of betrayal, mistrust, and resentment from those closest to them. Communication breakdowns, emotional distance, and conflicts may arise, causing significant damage to the individual's support system and social connections. Another potential consequence of drug abuse is legal issues. Engaging in illegal drug use can result in criminal charges, fines, and even incarceration. Possession, distribution, or driving under the influence of drugs can lead to serious legal consequences that can have long-lasting effects on an individual's life. Legal issues stemming from drug abuse can also impact employment opportunities, housing options, and overall quality of life. It is important for individuals struggling with substance abuse to seek help and support to avoid these negative outcomes. Advice for moms and dads. The teenage brain is still maturing. Foster a healthy communication environment. Utilize moments that provide teaching opportunities. Educate children about the detrimental impact of alcohol and drugs on the human body, along with the legal repercussions linked to their use. If parents avoid discussing the risks associated with underage drinking and substance use, their children may not recognize the potential harm in trying alcohol and other substances. When you encounter a character smoking in a film or television show, address the topic of smoking and its impact on the human body. Emphasize the dangers of drugs and the various problems they can cause in the body. Engage in outdoor activities or take a car ride with your teenager. By reducing direct eye contact, your teen will feel less scrutinized. Avoid providing alcohol to your teenager. It is a misconception that introducing alcohol at a young age promotes responsible drinking habits. Refrain from sharing stories about your own alcohol or drug use during your youth, unless they convey a valuable lesson. Demonstrating your care and building a stronger parent-teen relationship can be achieved by staying involved and monitoring your teenager's activities, both online and offline. When discussing how to decline offers of drugs with your teen, focus on the behavior rather than criticizing the person. Emphasize that drugs and alcohol are not effective or healthy ways to cope with problems, while acknowledging that everyone faces struggles at times. Make sure your child knows they can trust you. Protecting children from drug abuse involves addressing their mental wellness, especially considering the challenges young people face today. It is crucial for parents to recognize when their child may be going through a difficult time and support them in managing feelings of anxiety, stress, or other mental health issues. Promoting healthy family dynamics, nurturing a feeling of inclusion, and establishing a nurturing atmosphere that acts as a safeguard against substance misuse. Adolescents typically seek acceptance from their peers. Therefore, if their friends engage in substance use, your teenager may feel pressured to do the same. Stay informed about your teen's social circle and whereabouts to better understand their influences and potential risks. Foster a nurturing and welcoming family atmosphere that encourages children to express their emotions. Make it a habit to engage in regular conversations with your children. Allocate quality time for shared activities that bring joy to the entire family. Establish clear boundaries for unacceptable behavior and have open discussions about the rules to ensure your child comprehends them. Incorporate regular conversations into your daily routine. Additionally, find opportunities to engage in enjoyable activities as a family. Establish clear boundaries for inappropriate behavior and discuss the rules with your child to ensure comprehension. Parents and guardians can ensure the safety of their children by being mindful of potential substances that may be abused in their homes. It is important to keep these substances out of sight and in a place where children cannot access them. Show your support and involvement in your child's life by attending events such as sports games or recitals. Additionally, take the time to ask about their day and let them know that you are there to provide emotional support if they are feeling upset. Encourage positive behaviors in your child by connecting with their friends' parents. Take the opportunity to introduce yourself and establish a relationship with them. This can help in motivating positive behaviors and creating a supportive network for your child. It is crucial for children to learn how to handle their feelings in a healthy way, and parents play a significant role in guiding them through this process. By encouraging open communication and providing a safe space for children to express their emotions, parents can help them develop important emotional intelligence skills. Another important aspect of parenting is to stay involved in your child's academic and extracurricular activities. By regularly checking in with teachers, coaches, and other adults who interact with your child, you can gain valuable insights into their progress and well-being. This proactive approach allows parents to address any issues or concerns early on, ensuring that their child receives the necessary support and encouragement to thrive in various aspects of their life. In addition, parents need to have open and honest conversations with their children about their whereabouts and social interactions. By discussing who their children are spending time with and where they are going, parents can help establish trust and accountability. This level of communication not only fosters a strong parent-child relationship but also helps parents stay informed about their children's activities, ultimately reducing potential risks and promoting a safe and secure environment for their children. Parents and guardians play a crucial role in guiding their children through the influences of social media, television programs, movies, and songs that may glamorize drug use. It is important to have open and honest conversations with teenagers about what they see and hear in these platforms. By discussing the potential dangers and consequences of drug use, parents can help their children develop a critical mindset and make informed decisions. Enforcing a non-privacy rule at home can also be an effective strategy to prevent drug use among teenagers. Parents can create a safe and supportive environment for their children by setting clear boundaries and monitoring their online activities. This can include limiting screen time, monitoring social media accounts, and having open communication about their online interactions. If parents suspect that their teen may be involved in drug use, it is crucial to seek help from a healthcare provider or counselor. Early intervention and support can make a significant difference in deterring children from drug use and helping them overcome any challenges they may be facing. By addressing the issue promptly and seeking professional guidance, parents can ensure the well-being and safety of their children. Preventing drug abuse among children is a complex task that requires a united front from different stakeholders, such as schools, parents, and communities. Through a joint effort, these parties can establish a nurturing atmosphere that protects children from the dangers associated with substance abuse. School engagement and community support are crucial aspects of this collaborative approach to prevention. Schools play a crucial role in educating children about the risks of drug abuse and providing them with the necessary skills to make informed decisions. Additionally, communities can offer support through various initiatives, such as awareness campaigns, counseling services, and recreational activities that promote healthy lifestyles. By fostering strong partnerships between schools, parents, and communities, we can create a comprehensive prevention strategy that equips children with the tools they need to resist the temptations of drug